Good afternoon. Thank you very much, Madam Chair, for the kind introduction. Yes, I'm coming from Athens, where we have the first ever WHO Quality of Care and Patient Safety Office. So it's kind of an innovation I'm going to try and report to you here today. As you probably know, we have 6 regional offices worldwide of WHO, and all of them have some dedicated teams working on quality and patient safety. But I think that in Europe we are breaking new ground because this region has a specifically designed, developed office totally dedicated to quality and patient safety, and that obviously includes the human experience with healthcare and the patient experience and family's experience, which for us is very important and is really part of our vision moving forward in improving quality of care in the WHO European region. This office is based in Greece because it has a great support from the Greek government, but is providing assistance and is working with many countries in our region, as I will try and give you some snapshots and some examples of many of the things that we are already doing. And it's an initiative which is populated with people working in the team from different corners of the WHO European region. So I'm very happy and really delighted being here with you today. We are honored with the invitation. It's in a way a sign that we're starting to be well known. We are we are an infant, really. We are not even 3-year-old. And, but I think that we are starting to make a difference, being better known, and trying to bring some topics for the discussion around quality of care and patient safety, which is really for us extremely important, because that's something that really matters to people. And today, because this session today is actually about data this afternoon, right? And because it is about data, we normally are used to look at quality of care from a very process-related perspective. We believe also, like healthcare, quality needs to be more human and needs to have more emotion in a way. So some of the data that we have to use around quality, yes, we need to look at process indicators. We have 150 around that OECD. We have also other people that are working in quality. We know how cumbersome and difficult it is to measure that. But we need to measure what matters to people. And we have to be honest. Sometimes we are not doing that. Therefore, I would like to start my presentation a bit with some snapshots, actually completely new from the press, well, not even in the press. So we are doing a series of studies with our partners around the globe. And one of the studies we conducted in 2 countries in the European region, we hope we can do more in the near future. We were really trying to understand from a population perspective, not just the patients that go to the hospital, not just the users of the system, because many of us, well, some of us have never go to the doctor, or you do it maybe every 10 years. You go to some facilities in the context of your health system. So you always have a biased impression if you talk only with patients, if you talk only with users. You need to go a bit more beyond. And very interestingly, I mean, in one of these countries, I'm not allowed to disclose which country it is, but you can imagine, think about it. And so we asked the population to rate the quality of key primary care services that they were provided. The darker it is, the better, let's say, they feel in terms of the service that was provided. So just to give you an example, if you think about care for children, right, less than 1 in 3 members of the population believes that the service was excellent or is excellent, right? If you want to think about mental health, everyone is worried with mental health these days, right? Mental health is at the top of the priorities. We have a part of our program in Athens which is really focused on the quality of services for mental health of children and adolescents. We are concretely looking at that as well. And it's about 1 in 10 that considers that the service is excellent. And if you look at the, let's say, the gray bar there, I mean, look, it's 6 out of 10 people that consider that the service is really poor when it comes to mental health. Care for chronic conditions, heart disease, diabetes, you see this, 2 out of 10 that consider that they received, let's say, excellent service. And we could continue. We could also, we all live in systems that have normally, most of us, a mix of private and public, or a mix, and it's also interesting to understand how the citizens in this country, and I don't believe that the picture in all of Europe, this is just an illustration, this is a specific country. Actually, you already have data for the other country, and it's not much different from this one. And you see the differences, which is really striking in terms of the perception that people have around the quality of the private health system, let's say, or the private component of the health system, and the public one is really extremely significant. Almost like three times more people consider that the private one is actually excellent. So a lot of food for thought, because this is not just about, measuring. It's very important to measure outcomes, but it's also important. Many things in life are about perception. If you don't take this into account when you design your health system, especially if you're a minister, or if you're going to run for elections, if you don't understand this, it's very important, really, to have an idea of what the population thinks about. So we're embarking into building fundamentally existing ways of collecting data around quality and patient safety. We really would like to move into at least being able to provide decision makers and the population with measures that really matter to them and that can really as all make a difference. If you're measuring everything, if you're measuring too much, then you're not measuring much. So you really need to do an effort to move forward, being more meaningful in terms of what we do. Actually, yet again, same example. We also ask them, how is the trajectory of your health system in the last years? 40% in the last 2 years think it's getting worse. But more than 70%, almost 80% believe it's getting worse or basically not moving, exactly the same. And if you ask them in terms of endorsement, some good things, but major changes are needed. So people really believe that you need to change a lot. This is basically way more than 2/3. But then when you ask people in terms of confidence, and you ask, for example, can you get good quality care if you are very sick? Less than 50% of the population says, yes, I'm confident I can get it. Can you afford good quality if very sick? Only 1 out of 4. And the same in terms of getting it and affording it, even less, around 20% only. And then, which was very striking to me, is that only 1 out of 4 believes that the government, when they make changes in the health system and how it performs, that they really take into account people's opinion. So maybe there is something fundamentally important which we are not looking at, which is really measuring stuff that matters to people. And we think that a lot of that is related with quality, right? When we talk about Agenda 2030, we talk about SDGs, and we talk about UHC. There is no UHC with quality. This is not only about access. It's also about providing services with the quality that people expect, deserve, and it's actually humane, like my friends in the morning were saying. So I think this is really very important. We may be not paying enough attention to the quality dimension when it comes of achieving UHC. So it's really important, I believe, to look into that. And whenever you look at different frameworks to evaluate health systems performance, quality always comes as an important element, but sometimes it's one more piece, right, in the puzzle. Perhaps we would need to reconsider and see if quality is not really the one at the center that is decisive in terms of moving forward in improving health systems in a way which really gives people what they expect and what they need while giving us all outcomes. However, it's very difficult really to achieve this Agenda 2030. We know that in many SDGs we are really lagging behind. And we know that in the context of health and well-being, there are not really, we cannot be extremely optimistic. A lot of work to be done, and we only have like 7 years, right? Race to the finish. Do we have time to race to the finish now in terms of SDGs and in terms of quality? Well, I don't know. We all know that the pandemic, brought enormous transformation in the system. We know that technology is also a major challenge, unprecedented and foreseen milestones ahead of us in terms of these great opportunities as well. I'm not going to go into detail of the health workforce. I mean, it was enough explored in the morning. I mean, if more would need to be said about what the workforce is going through, and a different workforce, young people that want to have a life beyond the walls of the hospitals. Fair enough, right? I would say. They are the ones, right? Not us. So it's really a big challenge there. Burnout everywhere. Even in WHO, we also have significant amounts of burnout, which eventually might not be as different as the health professionals. So we're all into this together, and I think that many, many challenges. We talked about costs in the morning. We didn't talk much about climate change and environmental issues, which are really important in terms of achieving UHC and quality. And I think that the conversation this morning brought to the discussion the issue of people-centeredness, which is very important. There is no people-centeredness without humane treatment, without people's, patients, and families' empowerment. And that is really very important. And you will see that in many of our health systems. I have more fresh data to show you at the end of my presentation. And you will see that in a nutshell, where we're really lagging behind in many countries is on people-centeredness. We are doing better in other dimensions of quality. So if you use these 6 dimensions of quality that I show you on the framework, and I think we've developed an innovative way to look at that in the European region at the moment, which is unique to our region. But we are very optimistic. We believe that innovation is driving this and can really be at the center of improving quality. And innovation is not digital, at least not only digital. The innovation is really social engineering. This is what we were also seeing with this morning with some of these examples, really making sure that you engage people, that you involve all those in the process of care, from prevention to treatment, long-term care. Because let me put the record straight, many times people think that quality is about hospitals and within the 4 walls of the institutions. It's not. There's quality, very important, when you also exert initiatives around health promotion. And at home care, at-home care is one of the most challenging areas for quality, and we really need to pay attention to that. And you heard it also before this morning. So this is why we were super excited when we gathered several ministers in Greece less than 3 years ago. Actually, we had the Prime Minister and 4 ministers involved. It's rare. That said, okay, we acknowledge that our health system has a long way to go. We have many challenges in terms of equity, in terms of all these things. But we want to not just you to help us to change, you WHO, but we want to support also other countries. And they were very generous to sign with our regional director, Dr. Hans Klug, that you can see here in this picture, a decisive agreement that will take us for, I hope, at least 10 more years, maybe 20, in the continuation of having a decisive approach on quality of care. WHO Europe has a long tradition on quality of care, particularly in the 80s of the last century. Then it went a little bit down, and our regional director has been really very keen, saying, I want to put it again at the center, because it believes that there is no UHC without quality. So what do we do, you may ask? Well, one of the things we do is technical support to countries. So I could share with you that we are developing in Malta, together with them, a new action plan on patient safety, that we are doing something similar in North Macedonia, that we've just done it also with Portugal. Many things in terms of working bilaterally with countries. In Romania, we are developing a groundbreaking project where we're coming up with 25 indicators that the minister can use in the future to improve quality. With a certain, it's not a pay-for-performance system, but it comes with a bonus. When you improve quality, and quality in a broad sense, beyond process, then you can also get extra resources. But it comes bottom up. It's been done together with the people at the hospital level and also with the patients. We are very much into innovation. We have really some very interesting initiatives around harnessing the power of innovation around, for example, patient safety and many other areas. So we really would like to go beyond the traditional role, which is to provide direct support to countries, but really bringing inspiration through some of these innovations. Also policy analysis, and one of the things that we did last year, we established the first ever network of focal points for quality and patient safety. And we are very happy that we have representatives from Latvia there, and it's very important to continue together for the future. So you have more like a voice now. So we have a group of countries in WHO context, WHO Europe, working together for quality and patient safety. And I'm very happy also to say that we paid a lot of attention to patients and families' engagement, because this for us is critically important. Actually, we started that 2 years ago when we organized the first meeting of the minds in Europe on quality of care, where we had the pleasure of having some of those in the room here today, like Jason, where we, at the time we met online, and finally we meet in person today. So a lot of things we could do together with you as well. One of our obligations is really to collect information and data that can then be used by countries. We don't make judgments. We work with you, we collect the data, and we do it, we've changed the way we do it. We now do it as a draft. And then we put it for you, we work with you, we collect the information and the data, we produce drafts, and then you will let us know, does this represent what I'm doing in my country, yes or no? And then we fine tune. So this is the report we launched as a draft on the 11th of September, and now we're expecting feedback, and we're expecting information and confirmation also from Latvia on how to move forward. So it's the first ever draft, the first ever European quality of care and patient safety status report, has not been done before. What did we discover there, if we discover something? And Chair, please let me know if I'm talking too much. My dear friend, Professor Lasdan, knows that I'm very good at talking too much, right? So, main conclusions from our report. countries are not really collecting certain types of information and data, and on top of that, they don't report to WHO. Okay, I mean, it's let's say, reductionist and minimalistic what I'm saying, but trust me, we had huge difficulties in finding data for some of the areas that we would like to report on. So what do we have to do? We need to work more together so that we improve this. A lot of data fragmentation, a lot of knowledge gaps, and this is, so you are ill-informed when you have to make decisions. So it's not enough. We have to do more, particularly when you're a decision maker, you know, CEO of an hospital, where you're a regional health authority person, or you're the minister. It's about quality, right? So you need this information to be more accurate. A lot of work to be done there. We also need to be more aligned and harmonized in terms of metrics and the standards for data collection. I mean, everybody, it's all over the place, if you allow me to say this, right? It's all over the place. So we have to be more harmonious in terms of how we collect this data. This is why we believe that having this network of people that work in quality and patient safety from all 53 countries of our region would be very important. And we also believe that we need more coordinated action, and I think that we are heading in that direction. So in terms of the report, just to share with you a couple of main apparent conclusions. People-centeredness reporting. So what we did, what you see here, we developed a composite indicator involving all the 6 dimensions of quality of care. And here you can see you have the WHO average there, okay, the middle. You have Q1 and quartile 3, and you can see the maximum you can achieve is basically 1 in everyone, and you can see that in general, as a region, we are very low, right? But then we have done this for every individual country. And I will give you a snapshot with the one that you have for Latvia. So obviously you can see that there are areas like people-centeredness, we are doing relatively bad. Rich countries are probably doing better, but a lot of countries don't have anything. So it's very striking here. So you have, let's say, a dozen of countries that are doing really well in people-centeredness, patient engagement, all of that, but most of the others are basically doing nothing. And it's very important that we also address that. So the dark one is high-income countries, okay? But you can see that for many areas we have little reporting, particularly from certain areas in our region where we have middle and low and lower middle income countries. So around people-centeredness and around efficiency, we really have a lot of room for improvement. So these 2 indicators, people-centeredness and efficiency, are the ones where, as a region, we perform worse. Almost as I close to the end, we also believe that there are certain things that countries can still do. We still have countries that don't have a national strategy or a national plan on quality of care and patient safety. Well, this is important, right? So we should be doing it. You see, there's still several where there is not much. Less than 20 have a national quality plan, some in progress, so there is a little bit of movement here. More or less the same for the patient safety. In some countries it's combined. There's no problem on that. But you see that there are many areas where, for example, dealing with misinformation. Misinformation is a quality problem. It's everywhere. It reduces, it reduces the impact of vaccination campaigns. You need to deal with misinformation from a quality perspective as well. Very few countries have it if you look at this, basically only 10 in our region. So really a lot of room for improvement when it comes to different dimensions of quality, and also when it comes to qualitative measures like the ones you see here, from national plans to, for example, quality for telehealth and telemedicine. you need also to observe that, right? The vast majority of countries, as you can see here, they don't have it yet. So all countries have developed telehealth one way or the other due to the pandemic. But if you think about number of countries that are actually looking into that from a quality perspective, way less than half of the countries in our region. So a lot more needs to be done there. So in a nutshell, as I finish, just to say that we are strong believers that quality is at the center, is the driver of positive change in healthcare systems. So a really drive for transformation. We believe that with innovative and system-wide approach, we can get there. We shouldn't be reductionist in this. We need to have a systemic approach, but we need to be pragmatic. And that is a difficult balance sometimes. And I don't have a solution to it. It's a question. Data is very important. We are doing really bad when it comes to data about quality. And data is measure what matters, not measuring everything. OECD, 160 indicators or 50, whatever, right? How many indicators can your country actually measure? The country where I am, in Greece, they cannot measure more than 50. And in another country where we have a big project I just talked to you about, we are struggling to measure 25. We are going to do it only because we are working with people, with the health professionals in the hospitals. Otherwise, it wouldn't work. And we are doing it as a pilot in 6 major institutions. But we are struggling with this data. And we have to, I love surveys. I've done surveys all my life, you know, but we have to go beyond surveys. We need to look at different ways to get our information and data. And that is a long discussion that we are having also in the context of quality. Basically, when we talk about quality, many times we forget equity. And there is no quality without equity. Inequalities are very serious in our region, and we really need to take that decisively. Collaboration probably is maybe the last word I would like to give you, to leave you with. Thank you very much.
Thank you. Thank you so much for this very interesting...
By the way, first ever European quality of care and patient safety autumn school, WHO autumn school, late October in Portugal. If you are interested, we can talk about it. Thank you.
Thank you so much. Thank you so much for this really interesting